Welcome everyone, Dr. Naveen here from MedCampus. In this video, we'll quickly discuss what are all the ECG changes that we see in case of different types of MI. So when I talk about myocardial infarction, we deal with ST segment elevation MI. That means the characteristic finding what you see in an ECG is, if this is P wave, then you have a QRS complex and this is an ST segment, right? Starting from S wave, you have T wave. This ST segment usually shows, okay, there would be this ST segment usually shows elevation. So this ST segment elevation which you see is not unique to MI. There are other conditions like ischemia, pulmonary embolism, Prince metal angina. There are a lot of conditions wherein ST segment elevation seen. The characteristic of ST segment elevation seen in case of myocardial infarction is it will be seen in contiguous leads. That is not in one lead, 2 to 3 different leads you will see these changes, and there will be reciprocal ST depression in leads opposite to the site of the lesion. So this statement is very important. So what are the different types of MI you expect? If it involves anterior wall, then we call it as an anterior wall MI. If it involves septal wall, it is septal wall MI. If it involves lateral wall, then it is a lateral wall MI. Similarly, if it involves inferior wall, then it is an inferior wall MI, and posterior wall MI if it involves posterior wall. Right? These are the different types of myocardial infarction you see based on the wall, involved wall of the heart. Now, coming back to the leads, the ECG which we do is a 12 lead ECG, we all know. So what are all the leads we have? We have V1 to V6 and we have lead 1, 2 and 3 in Romans, and we also have leads AVF, AVL and AVR, right? Now this is the basic introduction to the topic. So our topic of discussion is, in MCQ based exams, they will give you an ECG and they will ask you to identify where is MI present. Is it on the inferior wall or is it on the anterior wall? Because these are the two common entities which we see, anterior versus inferior wall MI, right? So let's now look at where the lesions are present based on the ECG lead changes. Now usually we have precordial leads. So the precordial leads are, if you draw the shape of the heart like this, you have a septum, you have an anterior wall and you have a lateral wall. If this is septum, if this is anterior wall, if it is lateral wall, the mnemonic is SAL, that is SAL. SAL means, S means septal. Septal is V1 to V2. Anterior leads are V3, V4. Lateral leads are V5, V6. That means if there is an anterior wall MI, you will see ST segment elevation characteristically in V3 and V4. Hope you got the point. Similarly, if there is a lateral wall MI, you will see lead changes in precordial leads V5 and V6 and vice versa. That is, V1 and V2 changes are seen in case of septal wall MI. So this much is the first step. That is, just look at the precordial leads. If V1 and V2 are involved, it is septal. V3 and V4 are involved if it is anterior, and V5, V6 leads are involved, it is lateral. That is, the mnemonic here is SAL. Now let's try to extend this mnemonic by calling it as SALI. That means, you know, lateral leads are V5 and V6, right? Lateral leads are V5 and V6. Apart from that, lateral leads also have L, that is AVL plus lead 1. So if you want to know about only lateral wall MI, the leads that you need to look at are, along with V5 and V6, the AVL and lead 1, right? We are left, this is the second take home for you. The third take home is now inferior wall MI, what are the leads we see? Remember this mnemonic INF, inferior. Okay, just highlighting them. So N has, let me take a different color. Now N has two ones like this. Okay, so this is lead 2. Similarly, in has, this I has 3 lines in it. So it is lead 3, and you have F, that means AVF. Now this is pretty simple. If you want to look at, or if you want to identify or diagnose inferior wall MI, the leads that you need to look at are lead 2, 3 and AVF. Simple. Right? So these are the various leads that you look at. So we're done with septal wall MI, anterior wall MI, lateral wall MI, inferior wall MI. What about posterior wall? See, posterior wall is opposite to the anterior wall. If you see V3 and V4 ST segment elevations in anterior wall MI, posterior wall lies behind it. So you will see reciprocal ST depressions in V3 and V4. So ST depressions in V3 and V4 are characteristic of posterior wall MI. Now let's try to do an exercise to consolidate our learning. So a case of chest pain comes to you, plus cardiac biomarkers like troponin are elevated. Okay, cardiac biomarkers are elevated, and now you have done an ECG to look for ST segment elevation. ST segment elevation. So you have an ECG strip in front of you. Coming back to this side of the page, you have an ECG strip in front of you. So what are you trying to do? Now you overall have an idea what are all the leads associated with the sides. So let's start with V1. We all know mnemonic SAL. V1 is septal, V2 is septal, AL, that means anterior is V3, V4 is anterior. Now V5 is lateral, V6 is lateral. Along with V5 and V6, we have SALI, that means AVL is also lateral and lead 1 is also lateral, and inferior, okay, inferior lead 2, lead 3 and AVF are inferior leads, and the one which is left out, AVR, is related to posterior. So it's as simple as that. Now let's do an exercise here. Just look at this ECG which is shown here, this ECG. Okay. Now, where is the ST segment located? Let me highlight it. Let me see each and every strip. Lead 1, there is little ST depressions are there, ST depressions are there. V4 is normal, V5 is normal, V6 is normal, V3 is normal, V2 is normal, V1 is normal. Now look at lead 1, yes, there is an ST segment elevation. Lead 2, lead 3, there is an ST segment elevation. AVF, there is an ST segment elevation. That means I am looking at lead 2, lead 3 and AVF. So lead 2, lead 3 and AVF are related to inferior wall. So this is inferior wall MI. So this is how you should be able to diagnose the type of MI based on the ECG ST elevation, that is location which leads are involved.